Welcome back. It's 10:30 right now. When it comes to Omicron, some medical experts say we may not be properly testing for the virus.
Darshan Roger spoke with a doctor tonight to explain. She joins us now with that conversation.
Yeah, what's happening for a lot of people is that they are developing symptoms of what may be a cold or what could be COVID, but they're testing negative on those rapid antigen tests. And some medical experts say that with the increase in sore throat symptoms associated with the Omicron variant, doing a nasal swab may not catch it, but doing a throat swab can lead to a more accurate test result. Tonight, I spoke to an infectious disease expert from Johns Hopkins, Dr. Amish Adalja.
I do think that for people whose symptoms are predominantly in their throat, a throat swab may be better able to detect the virus than just a nasal swab. And I think that's always been the case. It just seems that sore throats seem to be more common with Omicron. If you're positive in the nose, that's great. But if you have a sore throat and you're negative, I think it does make sense to do a swab of your throat as well to be sure that your symptoms are not caused by COVID-19.
It's going to change the way that we test for COVID, though, because the throat swabs are not commonly practiced.
It may change the way that we approach testing, because what we want to do is make sure that we're getting the diagnosis correct. And if we tell someone they don't have COVID and we just swab their nose and they've got a sore throat, I think we should be doing another swab or doing kind of a combination test.
Federal guidance now has not changed as to how to test for COVID-19, but some doctors are suggesting throat swabs for their patients, especially ones who have had sore throats, as Dr. Adalja mentions. Of course, home antigen tests have been a critical part of this process, but new data suggests that the Omicron variant can be easier to miss on these tests. So if you're in this boat right now.
So you kind of have to look and gauge your symptoms and understand what the next step might be based upon how severe your symptoms are, what your risk factors are for severe disease, if you've been around people with influenza, for example, and then make decisions. It's not going to be one size fits all, but in general, if you're symptomatic and testing negative from COVID, it could still be.
So again, the most contagious part of this virus is during the first few days when you're symptomatic, and also probably a day or two before those symptoms even show up. Dr. Adalja says the rapid tests are not meant for throat swabs, but they can be used for that. You just might need to get some help from someone to make sure that it's done properly. Bottom line, he says, our testing practices are not perfect, so always best to be masked, keep your distance still, and be vigilant. Jim.